Today we're going to be talking specifically about DynaMed, and what I'd like to say really is encapsulated by this review in the Medical Reference Services Quarterly. Basically, they say overall DynaMed provides evidence summaries using an easy-to-read bullet format. It incorporates images, clinical calculators, patient handouts, and practice guidelines all in one place. And if I could add one more thing to what they've said, it's one of the cleanest and most intuitive of our database-style resources.
Thank you, Esther. But yeah, so one of the unique things, as Esther mentioned, is that it operates as a database, but in reality, it also acts as a point of care reference tool. Essentially, during those in the clinic contexts would be the most suitable for DynaMed because it provides an encyclopedic coverage of different health conditions, treatment options, all based on the highest quality evidence. And that's the other thing about DynaMed is that as a evidence summary tool, it also critically appraises the evidence that it's drawing from. So there's a couple different facts I wanted to kind of cover about what DynaMed is and its own value. So as shown here is that it has like tens of thousands of evidence summaries, again, across health conditions, treatment options, and so on across 35 different specialties, which we'll also kind of go into a little bit more in depth in this presentation. And the other important thing regarding DynaMed's coverage of the evidence is that it monitors the most up-to-date evidence from over 3,500 different journals, as well as over 200 guideline organizations. So it's a very robust coverage, and it really is in response to the fact that with medical information in particular is such a fast and rapidly changing landscape in terms of how often it's updated on a daily basis even, to where no one clinician is able to fully encapsulate all that information all at once. So DynaMed is one of those responses where it comes up with this tool where instead of having to go through the primary research material yourself through, say, like PubMed or any of our other databases, DynaMed essentially summarizes and critically appraises that information for you as a starting point to figuring out what the best treatment options are, all the best available information about a certain health condition. And again, that's super important within a clinic context because really a lot of the times in the clinic, you might only have like a few minutes to really spare to really look up all the needed information that you require for your patient's well-being and care, rather than having to do a comprehensive search through, again, a database like PubMed. Another really important thing, as I said, the landscape of medical information is constantly changing, and DynaMed responds to that by doing a daily update using rigorous updating format and algorithms to where they're able to pull evidence several times throughout the day, in fact. And that was actually another point that we wanted to make, is that some clinicians and some of our faculty might be more familiar with UpToDate, which is another type of point of care reference tool, very, very similar to DynaMed, but there's certain differences that can be readily addressed. And in this case is the updating. So even though in the name UpToDate actually updates slower than DynaMed in comparison. Also looking into what kind of content and the scope of it and the breadth of it shows that DynaMed actually covers a bit more information and evidence throughout the different journals that it's monitoring, all the different guidelines that it's looking into. And again, the other point made here is that DynaMed also critically appraises the primary research and guidelines in order to propose recommendations for treatment and other types of points of care contexts. And In particular, DynaMed synthesizes evidence, clinical practice guidelines, and clinical expertise to provide recommendations to support clinical decision-making. In particular, DynaMed, with these recommendations, does so using the internationally accepted grading of recommendations assessment, development, and evaluation, also known as the grade system, which is used to classify its recommendations as being either strong or being weak. So by strong recommendations, that's typically used when DynaMed uses them, is when it's based on the available evidence where clinicians without conflicts of interest can consistently have a high degree of confidence that the desirable consequences, and this could be health benefits, decreased cost and burdens, etc., do or do not outweigh the undesirable consequences, harms, costs, and burdens. Weak recommendations, and DynaMed will identify them as being weak if on the available evidence, clinicians believe that the desirable and undesirable consequences are finely balanced or appreciable uncertainty exists about the magnitude of expected consequences. So essentially, it's when the quality of the evidence and the strength of the recommendation is not as finely tuned in terms of minimizing bias in the research. So another thing you'll recognize, and we'll kind of go over this as well with DynaMed, is that when these recommendations are made or written out in DynaMed's evidence summaries, you'll explicitly see that in the language. In particular, with the strong recommendations, they'll use the language like should or should not, versus with any weak recommendations, it'll say to consider or to suggest this potential option. So yeah, another great thing about DynaMed in particular as faculty and as students as well, and to emphasize is that DynaMed is available to both faculty and students, is that DynaMed is also integrated with SearchUSA, which is basically our own search engine that comprises coverage of almost all of our available databases, and DynaMed being one of them is also included. Other things that might be of interest to note with DynaMed, especially for, I know, with occupational therapy or anyone who's interested in pharmacology and pharmaceutical interactions, they'll be interested to note that DynaMed also incorporates drug information from the IBM MicroMedX database. Also, DynaMed offers over 500 clinical calculators, and we can easily go into this later on in the presentation, but they cover medical statistics, other types of tests and assessments for patient care. And then lastly, again, in regards to the fact that clinicians cannot always be they cannot always dedicate time and energy to researching the most current information available, is that you can actually, through DynaMed, alert yourself to updates on relevant topics and summaries that are provided through DynaMed. So you can see whenever they update something, you can be notified about that change. But yeah, so we'll go on and proceed forward.
Yeah, we'll take a closer look at some of the things Matthew mentioned as we proceed. Before we move forward, I will say that there are two ways to access DynaMed. There's a very direct way to access it, and it's through the library website. And you'll see under the menu, the main services menu, if you do the drop down, it will take you to databases, and there you'll see DynaMed, our nice big highlighted DynaMed right at the very top carousel. In addition, once you get in through the library website, the library will allow you to authenticate using your University of St. Augustine email and password through the single sign-on. In addition, once you're in, there are a couple of tools that are very specialized that you probably will want to create an account for. It's not necessary, but if you'd like to use the app on your phone and have that mobile access in the clinic setting, that would be a reason to create a personal account. If you want to use the DynaMed calculator, that's another instance that you will need that personal account that's free and easy to create. And if you want to mark down your continuing education, that personal account will keep you going. And you'll see on mine when I'm demonstrating that in a moment. Now, the way DynaMed works, we saw the strong evidence for why and how we can use this through Matthew's introduction of DynaMed earlier. But the way we'll be able to look at it is through browsing topics, searching. You can also search topics, and you'll be able to search keywords. And why don't we go ahead and take a look at that now? Now, raise thumbs up. Can you see the library? Okay, fantastic. Oh, so it's under services, resources, I'm sorry. Resources databases. And here in the top carousel, we see DynaMed. I'm going to go ahead and just tap on it. With the single sign-on, it's already logging me on, and it remembers me. I've already created an account, Garcia, and you can already see some of my credits up here. I'll go into, we will go into some of how that works later. But just going back to the presentation, we're going to be able to browse topics, search topics, and search keywords. So let's go ahead and browse. By browsing, we'll tap on the little down arrow next to specialties, and we can do a browse by a bigger, more general topic like palliative care. And from palliative care, we can narrow down a little. Maybe we want to look at end-of-life care and specific disease states. And just to go a little further, we have some topics here that we can tap on to get to our main topic. So we can do it by browsing. And that's going to be really great if you're not quite sure exactly what you're looking for, but you kind of are in the ballpark of what you're looking for. In addition, we can do a search for topics. So being back here at the main DynaMed site, I'm going to go ahead and search restless leg syndrome, and I can either search for topic or just search it as a keyword. So let's go ahead and search it for topic. And the difference is when I do my search for restless leg syndrome, I can either go to, if you notice it says go to, directly to the syndrome, or search for, we'll do the keyword search. It doesn't seem that intuitive what the difference is, but it doesn't really matter because I'm looking for restless leg syndrome, the topic, and it's trying to take me directly to what they believe I'm looking for. And one of the things that Matthew and I have talked about several times is just how clean it looks. I mean, can you see all the beautiful white space? It lets your eye go right to the information that's going to be pertinent to you. All right, so that's doing searching through the topics. And now we're going to just try the keyword search because it does something a little bit different. So we're going to do our restless leg syndrome search, but now I'm going to do a keyword search. And you'll be able to tell immediately what the difference is between doing these two searches. And one thing you'll also notice is how intuitive it is in trying to guess what I'm trying to search. Not unlike Google, it's trying to autofill what it thinks I'm going for, and they're right on the money here. So now that I did my keyword search for restless leg syndrome, it doesn't take me to the topic. It takes me to a list of different topics that include restless leg syndrome as part of it. And those topics might be conditions like syndromes or diseases like restless leg syndrome, or they might be management, like therapies or medication. They might be prevention tools or approaches to patients. So let's take a look. The first one, can y'all tell what it is? It's a condition, because it says right on top, condition. Then the next one is an approach to patient. Then we have another condition. Then we have a drug monography. And as Matthew had explained earlier, it is the medication drug information is accessed through IBM Micromedics, and so on and so forth. I can just keep going for more results. It's not overwhelming me with results, and I am going to say this over and over again, how clean it is. All this beautiful white space, and inside of the white space, we've got this beautiful gray space. It's telling me this is one topic, this is another topic, this is another topic. And once we're here, once we've done a keyword search, we can also click on, do y'all call this a hamburger button, ellipsis, pancake? Well, the three little dots that have many names, the ellipsis, if you tap on it, instead of going to the topic, I can go right to the diagnosis. It'll give me all the information within the restless leg syndrome topic. I can go right to patient information or to the overview. So let's see what this looks like. All right, so we already had a preview of what this might look like. And I'm going to start off by telling you all a little bit about what Matthew talked about. DynaMed as a system, as a database, does update day to day, but it doesn't do it for everything. Not everything needs updating every single day. So I'll show you all in a moment where you can see when the latest update came up. We can also see, this is really important information literacy. Who wrote this? Who came up with this? DynaMed is our corporate author, but you'll be able to see under restless leg syndrome in that topic that I was showing you, who exactly put this together. So you'll know whether that person has any biases or if they have any conflicts. Or any of their credentials, and maybe they're authors on the topic you might want to follow up. In addition, we do have our overview. Here, I'll go step by step so that we're not getting too confused. So first of all, we have our topic. On the left-hand menu, we have our subtopics within the main topic being restless leg syndrome, which is a condition. Now, when's the last time it was updated? Last September, which isn't too bad. And you can also see that last time it was updated. And it's been updated quite a bit within the last 2 or 3 years. Let's go back to the topic. Over to the side, we have our author, so we can find out more about the topic editor, the recommendations editor, and what their affiliations are. If I come over to the background, this is so beautiful and easy to read. I get what you would typically go to Wikipedia for, right? Usually you just want some broad strokes to get you started. Well, you don't need to go to Wikipedia. You can come right here to find out that restless leg syndrome is a neurological disorder and what it's characterized as, all within one sentence. And then we have 3 bullets that give us a couple of background information. Then we have some evaluation. And then just a real brief overview of what management would look like. Just within these first 3 pieces of information, right inside the overview, just a little bit of scrolling down, we already have a lot of the main information we're going to need. So a clinician that's out in the field is talking to a patient, and that patient is experiencing what they consider to be restless leg syndrome. They don't have to move mountains. They don't have to scan every single piece of documentation to get evidence-based information about what it is in case they forgot. They don't remember every single syndrome because they don't deal with it day in and day out, how it should be evaluated, and ways that it can be managed. So all that information is right at their fingertips. And if I scroll a little further and we go to related summaries, I really like this because it'll tell you other places, other topics that they have within DynaMed that are related. If it's not looking like it's restless leg syndrome, let's take a closer look at nocturnal leg cramps and go from there. Look at that topic overview. We have the general information, the epidemiology, who's the most affected. So if it's someone who's typically not 35 years and older or a woman, then, you know, it's just something worth paying attention to. We have the history of restless leg syndrome and the history of present illnesses, the diagnosis. And if we take a look, okay, so if we look at the history, you'll see throughout this topic, if I put my mouse over the subscript numbers, it'll show you the references that the authors have used to create this. And it's a shortened reference list. It's not overwhelming, but I can try to find the article Restless Leg Syndrome through the National Revolution Neurology Journal by Treckenwelder and get that information, see what they originally meant by what they were looking for. But so we have our cited information, we have the evidence. And in addition, some of this information isn't in the references page, but it is also cited. So I can go to the article about sleep medication and published in 2014. And you'll see that it's got the little box with the little out arrow, and it'll take us to that article, whether it's in PubMed or if it's or wherever it's located at. All right, let's see. Okay. So we have, in addition, patient information, and one of the things that's so fun about patient information is it has the handouts for you. So if I'm a clinician and I've got my patient that's experiencing restless leg syndrome, I can get a PDF handout printed and to the patient, and they'll have that information to go home to. And this information, it'll tell you where it's from the American Academy of Family Physicians, from the American Academy of Sleep Medicine. All that information, all these handouts are just so powerful when you need to present something to a patient that they can take home and absorb the information. And the last thing I want to point out is the ICD-10 codes. These are going to be really important for the clinician that's out in the field because they're going to need to know how to classify this on a chart, on an organizational chart, so that it can be put in the patient's records, so it can be charged to the insurance, and they don't have to dig around to find the G25.81 for restless leg syndrome. The ICD code is included right here. Matthew is now going to tell us, oh, and within this topic, you'll see, I wanted to see if I can, some of the citations are from studies or from randomized controlled trials and even further. And let me see. Oh, okay. And so right now we're looking at other management. The only thing I really want to point out is that it'll tell you the level of evidence that they believe that they have classified the different studies. So this study summary talks about infrared light, and they're saying that it's mid-level evidence, 2 being in the middle, 3 being less information, and 1 being gold standard. All right, thank you. I really want to let Matthew give us a little bit of overview of some of these rehabilitation therapies that are going to be really valuable for our clinicians that are in the classroom and that are out in out doing practical work. Matthew, if you want, just let me know, and you can share your screen too.
Sounds good. Thanks, Esther. But yeah, so essentially as this slide shows, is like to kind of introduce like what the different types of topics and specialties and other summaries that are available for faculty and for students. And we wanted to pick out some of these since we thought they would be really relevant for a lot of the disciplines that are being taught through the university in regards to sports medicine, physical medicine and rehabilitation, geriatrics, pediatrics, psychiatry, since I know a lot of the occupational therapists in particular often deal with psychological and psychiatric dimensions of care. And then there's also palliative care, as Esther also demonstrated in the search. But yeah, let me go ahead and share on my screen. Let's see. Perfect. Just get a thumbs up if it's all right. Perfect. But yeah, so kind of like what Esther was showing was that, you know, you can browse through the different types of specialties available. You can also do the search as you showcased as well. In particular, because I know you were also referring to the grading of the evidence is like, that was another important thing that we definitely want to delve in deeper, because I'm sure with faculty and with students and clinicians in general, they want to know that, you know, a source like DynaMed is not just pulling information, not really appraising the actual quality of each study. And so yeah, just to emphasize is that every study that is identified and selected for inclusion in DynaMed is rigorously and objectively appraised. This appraisal is coming from an editorial team that is trained in evidence-based medicine. So each study that is collected, and as Esther showed, undergoes a process of critical appraisal, assessing the research to evaluate its trustworthiness, its relevance, and its clinical value. And yeah, and this allows this process allows for the research to actually become an applicable and relevant approach to evidence-based medicine. So DynaMed's critical appraisal process essentially involves a systematic identification of potential sources of bias in order to objectively communicate the relevant clinical takeaway in the context of a study's limitations. So just as a reference, I'm going to go to say, let's say, acute low back pain. And kind of what Esther was also demonstrating was with the, say, like the, let's find a study. Yeah, so for under normal activity or bed rest, we can see the study that they're referring to, and as Esther showed, you know, it'll quickly identify the level of evidence that DynaMed determined the quality of this the study to be, and in particular, as Esther explained, is that DynaMed uses a simple three levels of evidence system, making it really easy to quickly understand the quality of the evidence being reported in a summary such as this. And the kind of the rationale behind this, and they'll even provide this like transparent explanation as to what they mean by level 2, is that this study in particular represents research results that address clinical outcomes and demonstrate some method of scientific investigation, but do not meet the quality criteria to achieve level 1. And level 1 in particular is that this study not only demonstrates clinical outcomes and demonstrates scientific investigation, but what makes level 1 different is that it provides a robust criteria of quality control in terms of minimizing the bias within the study, so they'll actually determine that. So yeah, so that's a really important thing to consider, and especially kind of like what Esther was also explaining, is that this is actually really handy if you wanted to actually look into the different research available. So DynaMed can actually be a really good starting point if you were wanting to explore what a certain condition, say like acute low back pain, and actually investigate what kind of quality research is out there. And instead of necessarily starting out with a PubMed search, you can start here, find some really good quality evidence, and then move on from there to develop your keywords, all that kind of stuff.
Actually,
Yeah,
may I? Yeah, I
of
actually
course.
can't emphasize enough what Matthew said about a starting place. At the library, I feel like one of the things we see over and over again is students throw out keywords, and they don't quite know, they don't have a holistic view of what acute low back pain is, or restless leg syndrome, or whatever the topic is. And by having DynaMed give us like that spectrum of, very specific overview to broader, like to something a little broader, or just the evidence that's used for it, it will give them the context to do the research that is being asked of them in their classes. So a student that's, all they know is the patient's issue, lower back pain, and what treatment they want to use. But they don't necessarily know that there have been already all these studies that have told us, in broad terms, who your patient is, what what are they usually facing? What are the typical diagnoses? They may have to go through a couple of their textbooks to find the information that they can quickly get here. It's a real time saver for them, and in addition, it's a real gift to the faculty that's trying to explain all this to their students, but they they don't even know that DynaMed does all of this.
Yeah, exactly. To me, like as kind of an allegory in terms of like how librarians are particularly teaching for undergrad courses, if we were speaking about undergrad courses, is that they'll say like you can use summary informations like as a one that probably everyone knows is Wikipedia. Even though you may not necessarily cite from Wikipedia directly, you can look at their references and actually draw the actual studies that are being used, and you can evaluate on your own terms what that means. DynaMed, not to ever really compare to Wikipedia, but essentially has that same kind of purpose of like doing a jumping off point, finding evidence. But the really key thing about DynaMed is that it's high quality evidence, that it's rigorously peer reviewed, it's rigorously looked over before all this information is even published and made available to us. Another thing to really provide insight to is the recommendations. So just as a quick thing of where you can actually find those are normally located at the very top of the health conditions or any summary pages here. So say overview and recommendations. So you're going to be able to see the recommendations that I was alluding to a few slides ago. So you can actually see where addresses like strong recommendation, and stuff like and so on. In terms of like identifying like red flag findings, anything like that. So yeah, it looks like a lot of these are strong recommendations, and what that essentially means, okay, so I wanted to kind of elaborate a little bit more in terms of what these recommendations actually, how they're developed and how they're published, as actual quality decision making support tools. So essentially these recommendations are developed by a panel of at least like 3 members that include, that together form enough clinical expertise on the subject being, or that is being pertained to this particular summary. So it would involve a panel of experts on acute low back pain. And as Esther showed too, is that you get that transparency as to who was actually reviewing it on the right-hand side. And this goes with all of their, anytime there are recommendations being made, they'll include those identifying panel members. So essentially, not only do they have expertise in the actual subject, but also expertise in the methodology of the evidence being considered and expertise with guideline development as well. So panel members will make strong recommendations, such as the one I've shown here. If and only if there is a consistent agreement in a high confidence in the likelihood that desirable consequences outweigh the undesirable consequences across the majority of expected patient values and preferences. Panel members will make recommendations designated as weak if there's limited confidence or inconsistent assessment of dissenting opinions among the panel members, that desirable consequences outweigh the undesirable consequences across the majority of expected patient values and preferences. And the other important thing about these recommendations is that no recommendation is made if there is an insufficient confidence to make a recommendation. So they won't just make a weak recommendation and there's nothing behind it. Even the weak recommendations have to have some type of evidence going behind it. If there's nothing, then they won't make a recommendation at all. And that's sometimes why you'll see some of these evidence summaries do not include a recommendation. It may be perchance that there isn't enough evidence to really support one yet. But yeah. Another thing Esther was also describing about how students navigate databases and information. In particular, like I'm sure Esther can agree to this as well, is that we often get like student questions and inquiries about finding that one perfect peer-reviewed article published within the last 5 years in a highly respected journal that will fully encapsulate their question about acute low back pain or any other type of basic topic.
Hard agree.
Yes. So this is where DynaMed really comes in, because the thing is with a lot of the primary research, you'll never really find that one unicorn article that's going to encapsulate that answer for you. It's really going to involve either yourself doing a comprehensive search of all the available literature and synthesizing that yourself, or if you don't have enough time or you want a quick starting point, as we've kind of talked about, DynaMed can be your choice there because it's already doing that critical appraisal, that synthesis, and that rigorous review of the evidence for you. So it is a really, really convenient tool to have in your arsenal. So yeah, and then again, you'll find the full text links for the different studies that are being cited available through when it does the cross-sectional studies and other types of study summaries. Not only can you see a detail notes about the particular essence of a study, you can also find the full text yourself here. And you usually link to PubMed, and oftentimes you'll see a free full text, or you'll be able to see the USA Library full text access option as well. But yeah, and if you have any issues with that.
And you can always Interlibrary Loan.
Yes, exactly.
That citation, copy paste that citation, send it to us.
Exactly. Yeah, I think even with the full text options here, you can definitely do that for sure. Even with the USA Library, if we don't have immediate access, it'll redirect you to a full for a interlibrary loan request instead. So yeah, great point, Esther. But yeah, so there is that. I also wanted to, I'm going to go to the slide really quick. You're able to see that, correct?
Yes.
Perfect. So I'm going to fast forward over back to when we were talking about rehabilitation therapies. Not only does it have all these extensive specialties involved, but another timely topic is about COVID-19. And DynaMed is readily developing a lot of information and evidence summaries, as you've seen, relating to COVID-19. And these are some of the ones that we kind of identified as being particularly relevant to a lot of the faculty and a lot of the students and a lot of the programs in our university regarding special populations, patients with cancer, cardiovascular disease, pediatric patients and pregnant patients. So yeah, you can do a readily made search for any of these through DynaMed and be able to pull up the most up-to-date information. And I'm sure these are probably going to indicate probably the most updates in terms of changes to the information, especially as we learn more about COVID.
One of the things I love about the general COVID-19 novel coronavirus topic is all the spots where it talks about treatments. Do you think you could show that?
Sure, definitely. Let's see. There it is.
So do you want to show the updates?
Yeah, that's definitely a good point. Is also you can see the updates being made, and yeah, it's being made several times during the day, as you can see from the time that we're doing this session. So yeah, so it's being readily updated, and that's one of the other important things is that you might be wondering about doing alerts to yourself if you wanted to actually do that. Let me see if we had anything else after this particular slide. Yeah, we can actually continue with drugs. We'll talk about alerts in just a moment then. Esther, did you want to take over with this one, or you would like me to? Either way.
Yeah, that'd be great. Sure. Matthew, can I narrate?
Yeah, of course.
Why don't you go ahead and show your DynaMed
sure.
browser? Okay. So what we're going to talk about here under tools is we're going to start by looking at drugs A to Z. So if you'll hover your mouse over drug A to Z, you can click right on it, and you can go in alphabetical order to each different medication. You see some the measles vaccine. But let's go ahead and do a search. Oh, sure. Fantastic. So one of the thank you, just anyone. So this is what the topic looks like for any of these drugs A to Z. And you can search just any drug you can think of, whether it's the name of the generic or the name of the company that puts it together, the non-generic brand, the brand name for the medication or treatment. One of the things we'll see here is you can see the black box warning, the dosing and indications, the adverse effects, clinical teachings, how it's supplied. I really love the U.S. availability. Can you tap over on the left-hand side, U.S. availability? It'll tell you here the generic name, the trade name, any synonyms, any regulatory statuses, how it's supplied, and it looks like this one is supplied in 10 milligrams. And then we have our references, obviously. And we can also do a search for the specific medicine without going to the drugs A to Z. Also, up at the top menu, we have drug interactions. So we can do a search for, the first drug will be, let's say, acetaminophen. Can you type that
out? Can you put that in the chat? Just make it easy. Yeah, you can just put those in the chat and I can copy paste them.
You just put Tylenol, I guess.
Put what?
Tylenol.
Tylenol, okay. At least that's a little easier.
And then let's put,
let's see.
Oh, there's that acetaminophen. Do you see it?
Oh, this one.
Yeah.
There we go.
And let's do iron.
Iron.
If it interferes with iron. Yeah, just the top one. Yeah, perfect. Calcium iron. And it looks like we're good. But we can add drugs. So at this point, you can even do this for yourself if you're taking acetaminophen and iron regularly. And then you add onto it maybe a steroid or something. You can, you can just see how that would work, or like the specific steroid.
Yeah.
But, just, anything. It could be just anything. You could see
Wow,
where,
we're still lucky on this.
good on iron. The next thing is the continuing education. Matthew, can you show us how much continuing education you have right now?
Right there.
So I don't think it's quite enough for Matthew to be able to claim it, but each one of these searches you do, because up at the top you can see next to his CME, it says MChase, which is Matthew's user like not username, but it shows us that it's his account that's being used right now. And he did this creating that free account from earlier that allows you to set up alerts or get an app. And here we have every time he does a search, it increases the continuing education that Matthew can claim. And there are a couple of companies not companies, but organizations where he can claim the continuing education. He can earn what is called CME, CPD, CE for continuing education. And then right now we don't have any MOC yet, but the first one, which is basically the CE credits, there are organizations that, some of them aren't clinician organizations, but like the American Association of Pediatrics is one of the organizations that takes, AMA takes the C credits, American Academy of Family Physicians, and then some of those MOCs can be turned in through some of the organizations that accredit internal medicine, neurology, surgery, psychiatry, etc. I mean, if that's something that you're interested in, you can definitely look more into it. But all you really have to do is do a search. You don't have to take a whole class to try to start getting some of those CE credits. In addition, Matthew, will you just go to like a random, like acute back pain or something, or do just a general search? Yeah, falls in older adults. If you go all the way to the bottom of this search under references, you'll see their references, but if you go a little further on how to cite, it gives us what is called the Vancouver style reference that they've created, which is what the National Library of Medicine goes by. But if you go to help a little further down where it says about DynaMed, there is a section, oh, I'm so sorry, just next to, I'm so sorry, go back, Matthew. Next to about DynaMed where it says help, it will give you under the very bottom, perfect. It gives you suggested citations so that you're never in breach of plagiarism, and it gives you the Vancouver style, it gives you a suggested American Medical Association style, it gives you the APA style. So those would be suggested citations because this is a different kind of a source. It's not Esther Garcia wrote this article for the Medical Library Association Journal last September in their like 9th volume or something like that. This is a different kind of a source, so citing for this is going to be a little bit different. So those are some of our DynaMed tools. Oh, and the calculators. Matthew, do you want to go over that?
There we go. Yeah, definitely. So before I get into the calculators, that actually leads into alerts and basically creating your own personal account. So as Esther showed, is that you can actually see that I am logged in. So, okay, so this is a really important thing to illustrate, because I'm sure faculty or students might have a confusion about, whether they're logged in or not. So if you go through the normal website here and go through databases, go through DynaMed, and then it automatically logged me in because I'm already logged into like Blackboard and everything like that. So essentially, as Esther kind of explained, is that once you log in through that, just putting in your username as your USA email, and then your USA password or email password as your password to DynaMed, you're logged in. You're good. You don't need to do anything more. But if you do want a little bit more access to the calculators, or to actually create personalized alerts to yourself about any current changes, you can definitely do that. That's a personal account. It's not required. It's completely optional. So I wanted to stress that, because I'm sure people might have a confusion about that. So, so yeah, essentially, if you were just to look at this, you hadn't logged in, you haven't registered at all, you would see, I'm going to actually just sign out for our purposes here. You'll see a like subscribe or sign in now kind of thing, or it also indicates register. Register now, and super quick process. It takes like 15 seconds really, and yeah, you can put your name. You can put any email you want. You can just put USA just for consistency's sake, and just do the same password for consistency. But again, it's a personalized account, so it doesn't really matter. But yeah, so once you do that, you'll be able to sign in. I'm going to do mine really quick again. Let's see. And once I'm signed in, it'll not only log all the credits that I'm currently accruing right now, but you can also access the calculators, because otherwise, if you don't log in, it'll say, please log in first. And that's what it's essentially talking about, is your personal.
Before it lets you open the calculator.
Exactly. And just to kind of like a quick sweep through what the calculators can refer to, is statistics calculators, can refer to search by specialty, so any nursing related calculators. Pain management might be really useful to you, pediatrics, and there's certain like tests and like assessments that you can easily do with patients. But yeah, so feel free, and also probably also important for students if they're still learning about the full breadth and scope of glossary terms, abbreviations. They can easily refer to the calculator section, where it has a glossary of acronyms, abbreviations, and initialisms, and they can easily decipher what those mean as they learn them themselves. But yeah, so there's that about calculators. There's also alerts as well. So say I was really interested in about falls in older adults.
Which is a very common topic.
Yes, it's a very, yeah, I get that inquiry so much about.
I get that question a lot, yeah.
Yeah. So if you ever want to stay updated to what it is, I'm going to quickly do that just for the sake of it, because I was already following it. But essentially, if you want to follow any changes to the actual information listed here, all you have to do
the topics or drugs.
Exactly. Yeah, it can be any of these evidence summaries. Yeah. You can just press follow. And one of the great things, and this is actually different from the up-to-date tool that I've referred to, the kind of like the rival tool for this, they would only do alerts on DynaMed itself, and you can totally, or on its own, on up-to-date's interface, you can get alerts that way. But DynaMed's different because it can actually send you email alerts. So it can actually send you directly without having to log into DynaMed, you can get those alerts. But for the time being, I'm not interested in doing an email, so I'll just press follow. And the way to see that on DynaMed is on the recent alerts here. So you can actually see any of the followed topics that I have. I believe I'm under falls in older adults, and also acute lower back pain. And then, but you can also follow any just current updates to anything in general. So anything on like diabetes, alternative treatments for asthma, so on. So yeah, really great about that. Yeah, so I think the only thing to really kind of finish off, because I know we're at the end of our.
Yeah, this is going to be actually, I'm so sorry, Joel, but this is going to be really important for you since you're, because of the role you play.
Mhm.
Um, Matthew, could you go to the next slide?
Of course.
So one of what we really want to stress to you, especially because you're helping
Mhm.
faculty create content and see what's pertinent, is how can they use this? How can they use this, especially the faculty in Blackboard? And there are really just, there are three, we have two on there, but it's actually three ways. And the last one is not that efficient. So that's probably, I think I kept debating whether to use the last one or not. But basically just link to DynaMed. So in a class where you're talking about specifically falls in older adults in a certain section, you can tap on, you can word it as visit DynaMed, and then put the link, the direct link from the library, and then tell them from there search falls in older adults or palliative care or chickenpox, whatever it is, acetaminophen. The other thing you can do is you can email somebody at the library and just say, I'm interested in the information about palliative care, especially ethic and legal issues topic. Can you create a persistent link or a permanent link that will never change? It'll always take me to the right page. Then one of us will just type it up, like get it to you, and done. You do have the option under the topic to email the link, and that's not the worst way, but it's the worst way. So the last, I think we can skip right to the end, Matthew. But that information is going to be really important. At this point, we'd love for you, I'm going to stick this little short, very, very short
We
survey
promise.
uh, in the chat. And if you'll just go to that survey and fill it out for us, it'll help us immensely. But in addition, while you're doing that, can you tell us like any feedback do you think that you think would be useful for us, including if do you think that you can see yourself using DynaMed in the classroom, or did you discover something new? Is there a feature that really excited you while we were talking?